Now, moving on, erectile dysfunction is a handout in your packet somewhere in the midst of everything. It says, remember, no nitro for men on erectile dysfunction drugs. Because the number one side effect in the box on the right that you need to highlight is hypotension. Now, the definition of erectile dysfunction is the inability to achieve and maintain an erection, obviously. So the inability to achieve and maintain an erection. And usually the number one reason, which is really interesting, because it's not anywhere on here why this happens, the number one reason is coronary artery disease or diabetes. Coronary artery disease, which is called atherosclerosis, coronary artery disease, or diabetes. Most of these guys drink and smoke, which just makes it worse. Or had a previous stroke. Now, other reasons why they could have a problem, which is why I told you for prostate cancer, it might be better to leave this guy alone, is when we take a patient with prostate cancer and we take their prostate out, like a prostatectomy, then they're going to have this. They're going to have erectile dysfunction. So one of the reasons this guy could have this is we took the prostate out. Prostatectomy. Okay, prostatectomy. We might have done that to the poor guy. He could have injured his back, especially in the military. We get a lot of our veterans who have problems with this too. So back injury. Okay. Now, by definition, it's gradual, diminishing firmness over time. Gradual, diminishing firmness over time. The risk with this medication, highlight one more thing, is priapism. And you can color the little, shall we say, oopsie in the sheets and write priapism. Erection for 4 hours or more. And you may be thinking, what's wrong with that? Sounds like a good time. No, it hurts. So this is painful erection for 4 hours. You colored the little sheet action there he's got going on. And if you watch the Kardashians, you may have seen this with Rob years ago on the Kardashians. Okay. But those are one-liners. Everything on the board right now is a one-liner, and it's almost everything I ever wrote. So if you look at what I wrote that orchitis, and I'll write it a little bit higher too so you can see it back there. I wrote that orchitis and Epididymitis are basically very similar, so similar that we do the same thing for both. We use ice, we elevate the testicles, and we use antibiotics. Now, orchitis is obviously inflammation of the testicles. The number one reason, that's why I wanted you to know that orchi meant testicles. The number one reason a patient could have that is some type of infection. And then another reason that you had to know was the kid may have had mumps. the child may have had mumps and they get orchitis. So some type of infection, or this kiddo could have gotten mumps. Trauma to the area, you know, they got hit really bad and the swelling is just really bad. The patient with orchitis is going to have blood in the semen if they're an adult. Blood in the semen. Okay, so that's kind of crazy. Now, the epididymitis, not the inflammation, but the epididymitis is a small organ. The epididymis is a small organ that is attached to the testicle, and it's made up of coiled tubes that carry sperm away from the testicles. So it's a small organ attached to the testicles that carries, it's like coiled tubes that carry sperm away from the testicles. If this gets inflamed, it hurts, obviously. It's the same exact thing. Ice, elevate the testicles themselves, and antibiotics as needed. But they can get an abscess. That's where I put a little star for that one. That patient can get an abscess. Now I'm going to write a couple of little things. Varicocele, I'm going to write it up top here because we're all done with this. Varicocele. A varicocele is, think of in ladies, well, some guys too, when you look at that word, the way you're going to get that right on the test, think varicocele, think varicose veins. But this is veins, a cluster of veins in the testicles. So varicocele, varicose veins, or a cluster of veins in the testicles. And they hurt. It can hurt. Scrotal or testicular torsion, just so you know, scrotal, testicular torsion. This is severe groin pain. Severe groin pain in a young man and any age under 25. 2-year-olds, 12-year-olds, 20-year-olds. Severe groin pain, usually it's preceded with trauma. So you got hit in the groin with a football or whatever. It is life-threatening in terms of your fertility. So it is a 911 call. It is a 911 call. Who you see first or some shit. Okay. Well, that's that. Now, female reproductive, which is a big deal. For this, yes, baby.
The undescended testicle is a risk for cancer?
Undescended testicle is a risk for testicular cancer. I would write that. That's a good one to know. If you think of testicular cancer, a new baby, brand new baby, just born, if they're full term and they have an undescended testicle, which as a nurse, you're checking for the testicle in the scrotal sac at birth. Premature babies don't have, they never do have the testicles descended. But this is a child born full term. An undescended testicle is a risk for testicular cancer. I would write that one down. So an undescended testicle is a risk for testicular cancer.